Hi guys, welcome to my channel. My name is Elizabeth. I normally make mom and cooking videos, so if you like that kind of content, make sure you subscribe and give this video a thumbs up. And if you're already a subscriber, thank you so much for your support. Today I'm exactly 29 weeks pregnant, so I'll be talking about what's been going on in my pregnancy over the last week. My baby is about the size of an acorn squash and about 2.5 pounds. She'll be gaining close to half a pound a week for the rest of my pregnancy. As far as my weight gain, I've gained about another pound this week, which at this point is pretty much typical. As far as exciting food preparations this week, I spent all morning this morning making 2 quiches. My husband isn't really a big fan of quiche, but it's definitely a favorite for Dominic and I. And it freezes really well. I might freeze some individual slices of it. I figured that will be a nice and easy lunch that I can pull out to have sometimes with Dominic. The quiche has bacon and roasted red peppers in it, and for the cheese I used pepper jack and cheddar. It turned out amazing. Dominic and I had some for lunch today. I didn't really use a recipe. I kind of use a recipe for guidance, but I also kind of did my own thing too. I more use recipes just as inspiration, really, than for a step-by-step in most things. I didn't make my own crust. I'm not feeling that motivated today because my sister and I will be making a few pies for Thanksgiving, so we'll be making the crust from scratch for that. So I didn't want to get all into that today. Something I started doing this week, and everyone should start doing once they hit their 3rd trimester, is counting kicks. I downloaded an app called Count the Kicks. I know if you use the Glow Nurture app, you can also do it through there. There are probably a few other apps that you can use. With the Count the Kicks app, what you do is basically you turn it on and you tap every time your baby kicks or you feel some kind of movement, and then it stops the timer when you get to 10 movements. It'll show you a graph of how long your baby has taken to reach 10 movements, and it'll show you an average. Every baby is different, so it's really good to get to know what your baby's normal movements are at a particular time of day. I'm doing around 10 o'clock at night because she's always super active then. If your baby is always active at another time of day, you'll probably want to go whenever they're most active. She actually hits 10 kicks in just a few minutes, where Dominic definitely didn't move quite as much as she does. If she continues to make 10 kicks in just a few minutes, and then I might have a day where I notice she's not moving around as much, and maybe it takes an hour for her to get to 10, that could be a cause for concern and something to talk to my care providers about. Decreased fetal movement can mean that there's distress, so it's definitely something you'll want to start counting once you get around your 3rd trimester. Also this week, I've been noticing my bump a lot more. I definitely have to be a little bit more careful. I used to just be able to squeeze in between like a chair and the wall really easily. Now I might have to scoot the chair in. So just definitely noticing it a lot more and having to be more careful. Also at nighttime, that's getting a lot harder. I had a pregnancy pillow that I used with Dominic that was one of the big U ones. And I tried using it a couple days ago, but I'm just not into it this pregnancy. I feel like it's more confined. So I've just been using my regular pillow, and then I have a pillow about this big that I can wedge behind my back for back support or just put my arm around, and it's very comfortable. I can't sleep on my back at all anymore. If I spend too much time on my back, I start to get lightheaded. So it's better later in your pregnancy to sleep on your side, preferably even your left side, because that gets the most blood flowing. I usually sleep on my right side. Generally, your body will kind of tell you if you need to change positions, you'll get uncomfortable. So I've been switching back and forth between my right and my left side. I end up getting a little bit sore on my side after a while. I know Dominic, by the end of my pregnancy, I just wanted to sleep on my back, and that was one of the most relieving things once I had him, to sleep on my back again, but there's not much I can do about it. I've started to get a little bit of insomnia, not as far as not being able to fall asleep, but I've been waking up around 3 or 4 in the morning. Usually it's because I'm starting to get a little bit congested. So I know I definitely need a sinus adjustment my next time at the chiropractor. Sometimes I just have to go to the bathroom. Not every night, but sometimes I'm having a little bit of trouble falling back asleep, which is relatively common in pregnancy. I also had a few days where the foot cramps are back, even though I'm taking magnesium every night. I have noticed that every day I drink orange juice, I don't have a foot cramp. I've tried it not drinking orange juice, but eating a banana, because bananas actually have more potassium than orange juice, but I still get the leg cramps if I have a banana over orange juice. Apparently there's just something about orange juice that helps me not get leg cramps. I'm not a huge fan of drinking that much sugar, but I just drink a small glass. It's probably about 6 or 7 ounces, and that seems to keep the leg cramps at bay. So I think that's fine. I had a prenatal appointment last week. I've been seeing a midwife, but she actually had something come up this week, so she wasn't able to come into the office. So I saw an OB. She actually was the doctor that delivered Dominic. My plan with Dominic had been to have a midwife deliver him, but at my hospital, if there's some kind of higher risk labor, They'll have an OB come in, and Dominic was having heart decelerations that weren't recovering like they should have been. So they did have an OB come in for the delivery. So it was that same OB that came in and had my prenatal appointment with me this past week. I'm certainly not against OBs. I think if somebody has an OB that they like, that is wonderful. But it was very interesting to see the contrast between her and my midwife. With my birth with Dominic, they had to do a vacuum assist since his heart rate had dropped and wasn't recovering, which caused a really bad tear. And when I talked about it with my midwife, she said along the lines of, second babies generally come a lot easier, so while you could have a bad tear again or need a vacuum again, your chances of needing that are much lower your second time around. Whereas when the OB came in and talked to me, she started saying, well, you had a vacuum assist your first birth, so that means you have a higher chance of having to have one the second birth, and you have a higher chance of having a bad tear. And also if you hadn't had a good recovery your first time around, we would have to look at doing a C-section. Like, well, I recovered perfectly fine, so like, don't even know why you're telling me that. But it was just interesting that in my experience, OBs tend to think of things more along the worst case scenario, and we have to consider the higher risks. That's what their job is, so it doesn't bother me. But I've chosen to go the midwife route because they're more along the lines of, this is what a normal pregnancy should look like, and this is what we want to have happen for you. That just is less stressful and more along the lines of what my mindset is. I'm actually seeing a midwife that I haven't seen before next week because my midwife will be going on maternity leave in January. So I wanted to see the other midwife. As long as I get along with her and like her, I'll be seeing for the last few weeks of my pregnancy. So I'll let you guys know how that goes. So at my last prenatal appointment, we also reviewed my gestational diabetes, which instead of drinking the glucola drink, I was doing the blood sugar testing after each meal and fasting. She said all of my numbers looked perfect. So I'm officially negative for gestational diabetes, and I don't have to do any more testing. And then the other big thing that we talked about at my prenatal appointment was that last week I had blood drawn to be tested for anemia and low iron. My iron levels did come back a little bit low, but she said that was perfectly normal within a pregnancy, not anything to be worried about or have to take a supplement for. She said if I wanted to try and eat more iron-rich foods, that would be perfectly fine, but I shouldn't be worried. I do eat meat, but I have a hard time eating a lot of meat. Protein and meat especially just fill me up really fast, especially when I'm pregnant, so it's just hard for me to eat a lot of it. But if that means I should eat more steak, I'm all for eating more steak. My husband did a lot of work on the nursery this past week as well. My dad came up and the two of them painted it. We're going with a light green. I took a picture of it here. Keep in mind, this is not what it will look like when we're ready for baby to go in there. We'll get rid of some of that stuff and put baby furniture in there. And I'm going to put decals up as well. I got my eucalyptus leaf decals. I'm still waiting for the Australian animals, but they're actually shipping from Australia, so they'll probably take a few more weeks. And you're not supposed to put them on until the paint has dried for at least 3 weeks anyway. So we'll probably do that around Christmas and New Year's. Honestly, it's not really a rush to get the nursery done anyway because she'll be sleeping in our room for a while. With Dominic, we kept him in our room for about 10.5 months. We might end up moving her to her own room a little bit earlier because Dominic did have some trouble sleeping through the night until we put him in his own room, and then within about a week, he started sleeping through the night. So if she's ready, we might move her a little bit earlier, but definitely, I would say probably at least 6 months. We'll keep her in the same room as us, either in a bassinet or a crib, depending on how big she is. And that's something to talk about with your doctor as well. I think it's the AAP, American Association of Pediatrics, recommends keeping the baby in your room, but in their own sleeping space, like a bassinet or a crib, until 1 year. That way you can be with them if there would be any problems with them co-sleeping in the actual bed. That's associated with a higher risk of SIDS. All right, that's everything that's been going on in my pregnancy that I can think of over the past week. So I'll show you guys the bump. Thanks so much for watching. Don't forget to subscribe and give this video a thumbs up.